and I'd like to make it quite kind of informal. So kind of any conversations as things come up. And I was hoping to have a bit of a discussion at the end as well. I had a couple of things that I thought would be really helpful from my side, working in an NHS mental health service, to understand from you who are attending. So just to introduce myself, so my name is Sabrinda. I'm a cognitive behavioural therapist and long-term health conditions lead at an NHS mental health service. So we're primary care mental health, which is kind of mild to moderate symptoms. Clients are treated in the community with appointments, just like you would go for a GP or a nurse appointment. So I wanted to talk a little bit about supporting mental health in diabetes management. There's so much information around about the physical aspect and treating and supporting the physical side, but actually what we're now realizing, that having a holistic approach to chronic health conditions has the best outcome. So that involves focusing on physical but also equally on mental, and I'm just going to talk a little bit about the reasons why. So like I said, yeah, we're an NHS talking therapy service. We offer time limited talking therapy, which means just short term. So it might be a kind of 6-week treatment. It might be kind of a 10-week treatment. So diabetes and mental health, this is our focus within our service. So we're focusing on helping clients manage the chronic health condition, but also manage all the psychological aspects and challenges that come with having a chronic health condition. So in terms of the mental health impacts, it might be around low mood, feelings of being very overwhelmed, so having to manage kind of your daily life stresses as well as manage the chronic health condition. And emotional struggles can be quite common. So it might be worry about the future, worry about how I'm going to manage my condition. It might be stigma. It might be feelings of kind of guilt. It might be stress about it. But there's a lot of support available for this. So in terms of the psychological impact, obviously you are all the experts. But from my understanding, and from our service point, we'd see living with diabetes can affect self-esteem and self-identity, especially with type 2 diabetes and more recent diagnosis. The ability to maintain motivation for treatment sometimes. The ability to kind of maintain motivated to follow my treatment plan, follow my health guidance at all times, as well as all the other general stresses and hassles that I have to focus on in my daily life. Emotional responses to diet, medication, and lifestyle changes. We might sometimes we work with clients who have needle phobia, which is obviously for type 1 extremely important that we overcome this. So we'd work with them around this. Worry about long-term complications, how I'm going to manage my condition, are things going to worsen? And then also something called diabetes stress, which is, like I said, not only having to cope with the usual stresses of life, but having to handle the ongoing demands of lifestyle changes, implementing an exercise program, kind of anxiety about hypoglycemia, worry about stigma, maybe injecting in public, managing reactions of friends and colleagues. There are so many additional sides that come up with the diagnosis. So just to look at some cognitive sides, so from a psychological point of view, what we might want to look out for, and to have a think about if you notice any of these signs or symptoms in yourself. So sorry, the top's cut off for some reason, but cognitive signs maybe to look out for, where to understand kind of, is there a psychological impact, and is there something that could help with this? Is, if you have an upsetting image of yourself in your mind, which is how you fear other people may see you when you're talking about diabetes. These are all kind of implicit things that maybe we wouldn't think about day to day, but that's why I'm trying to bring it to the forefront and just think about, what is my self-view like? How do I talk to myself about my health condition? How do I judge or berate myself if I'm not following guidance or doing what kind of I think I should be doing? So having this this self-view, or kind of a negative self-view. Do you have thoughts that contain a lot of rigid rules involving words like I should, I must, I ought to, I must, I must? So, for example, I should always have blood glucose levels within the normal range. There's kind of a balance between, we all have these thoughts and rules, kind of I should, I must never, but actually, are they quite extreme? Are they quite, I do try and follow them quite stringently? Because if I've got so many rules and I expect myself to meet that level all day, every day of my life, is not possible. And the fact that I've got such a high level that I'm trying to work towards means that times when I don't reach it, or I don't follow my health guidance, or my symptoms become out of control, that's going to lead to me kind of blaming, berating myself. And it's that constant cycle. And that's what we want to work on in psychological treatment. Do you use thoughts involving extreme words like always, never, I must always do this, I must never do it wrong, I must always get this right? I must always be able to do everything that my friends and family can do. I must never say no to things because of my health. Bearing all responsibility for things that may not totally be your fault. So I'm going to develop serious complications and it's all my fault. Do you blame? Is there a lot of blame do you put a lot of blame on yourself? So for example, in terms of health advice or guidance, if you have a long day at work, blood sugar levels are low, feeling very exhausted, you might push yourself too much. It can be really hard to, on top of that, stay on top of everything I'm meant to be doing and ensuring that I'm totally in control of my symptoms. Other things come up in life and we all have to, a lot of people still work, still have a family life. So bearing all responsibility for things that may not totally be your fault is going to have an impact on your mental health and how you feel. Tending to focus on negative in situations rather than taking into account both neutral and positive. In terms of some of these cognitive signs, does anyone notice any of them in themselves, or is it something that they're aware of? I've only mentioned a couple, and there might be other ones that you notice in terms of your thoughts, your thinking, your views, your beliefs. I know people might not feel totally comfortable to share. Okay.
I I find sometimes related to sleep.
So there's a lot of just having to kind of sit with those feelings, sit with some of those thoughts, and sometimes we might not actually be aware of the whole psychological impact it has, because maybe you're so used to just trying to push it away and just carry on with your day. But there is help there that can support this aspect. The example you've just given is a little bit in terms of some of the behavioral signs I've mentioned. So it might be negative reactions or unhelpful behaviors. It might be avoid conversations about diabetes, actually not follow what I know I should be doing. Kind of try and, here it says drink more alcohol, smoke more, but it's just general unhelpful behaviors. And often when people feel fed up and frustrated with health and in general, it actually leads to those opposite behaviors, and we call it sometimes avoidant coping. And like you said, you can only do that for the short term because then your body tells you, well, I need this insulin. But there is a small response which is kind of, I just want to just avoid, I don't want to. Some people might engage in these more negative reactions more than others. The top point is you may force yourself to do the diabetes self-care task, but you find it very difficult or distressing. Well, if it's something that I need to follow every day of my life and I'm finding it really distressing, I think I need to find a way around that, about how to manage that distress. Otherwise, that's going to cause me a lot of psychological impact across my life. And these avoidant ways of coping are something that we see kind of across all types of mental health conditions, if it's kind of anxiety, depression, whatever. Okay, so where am I? And just to mention as well, if we think about distress around uh, diabetes, we want to focus on the kind of biological side. We also want to focus on the social side and then the psychological side. So within psychological therapy, we call it the biopsychosocial model. So we want to take into account the biological aspect of the client, but also what's their thinking style like, what's their mood like, and also their social aspect. Are there additional social problems which will be impacting them more? Do they have social support around them? Is there anyone that they can talk to about what they're dealing with on a day-to-day basis? Abu?
Just want to ask, would frustration be considered as behavioral? If I explain, I mean, there are days or weeks that the blood, I eat the same thing, do the same exercise, carry on the same thing throughout the day or throughout the week, and the blood sugar has always been fine. And on occasion, you woke up in the morning, it's sky high without, that's where my frustration is, you see? Even I try to control it as much as I can. When you look at it in the morning, you say, oh, how come it's that high? Or even during the day, it becomes high without any explanation why, you see?
And when you get that frustration, what do you do in response to it?
I just go to the gym.
Okay. Sounds like that's that frustration is that emotion. We can't control the emotion, but we can control kind of how we respond to it. And it sounds like that's quite a good way that you try and deal with it, going to the gym. But there are a lot of unhelpful behaviors that we might engage in response to frustration, aside from that. But that sounds like a helpful behavior, kind of coping behavior that you've developed in regards to that frustration. So I've just noted here a couple of thinking errors, styles of thinking. Okay, we all have these kind of what we call them distorted ways of thinking. And especially when we're stressed, if we're frustrated, if we're feeling fed up, if we're feeling down about our health, if we're feeling anxious or worried about symptoms, these distorted ways of thinking come up much more. They're much more prominent. And these are just a couple, there are a lot. And just on the left-hand side, just noted down. So one are kind of making rules. So the more stressed we are, or maybe if we've experiencing quite kind of low self-esteem at the moment because I just don't feel able to manage my blood sugar level and I don't know what's going wrong. More words like I should, I must never, I should always might come up more. These extreme statements that I mentioned before, bearing all responsibility. Catastrophic thinking that the worst is going to happen. If we're feeling anxious and stressed about our health, we're much more likely to jump to that catastrophic thinking, the worst case scenario. That's going to make me feel more anxious, and then it's going to continue that catastrophic thinking. We've also got that personalization, so taking the blame if and when things go wrong. Another example here is black and white thinking. So the world, life isn't black and white. There are a lot of grays, but we might think because I can't manage my sugar level at the moment, it means that I'm rubbish and I can't cope. Or because I didn't follow this advice, it means that I'm totally useless. So it's that real black and white thinking. And especially with type 2, there'll be because I did this or I ate this, or because of how my diet has been, it means this. So it's very extreme. And then there's one called mind reading that comes up quite frequently, and this is when we assume we know what other people are thinking, and we also assume what they are thinking about us and assume it as being something negative. And there's one thing, if there was a lot of evidence for this, but often this type of distorted thinking happens when there's actually no evidence for it. We're just using how we're feeling, but actually my feelings aren't facts. Just because you feel some way doesn't mean that that's what's actually happening. Our feelings aren't facts at all. So we need to be focusing more on kind of objective information around us. So, for example, how might we challenge some of these thoughts? So, I should take care of my diabetes perfectly. Well, is this rule reasonable? Is it possible? How realistic is this? Are you setting yourself up to fail? If I think I must always take care of it perfectly, I am setting myself up to fail, because that's not realistic every day of my life, alongside all my other daily tasks and responsibilities. This belief would need to be challenged. That's what the kind of work that we'd want to do in psychological therapy, challenge and modify it so it's a bit more realistic and that you can live by it, rather than having these very high level rules that are unrealistic and then we just beat ourselves up when we don't reach it. We've got, there's nothing I can do to stop diabetes complications. So this might be a belief that can be an easy way to opt out. Whilst it's true that no one can predict if and when complications may occur, by caring for the diabetes as well as you can, you'll be giving yourself the best opportunity. So this might be that avoidant coping. A lot of people don't engage in avoidant coping, but some people do. And that's the kind of thinking or belief that might come up. And then this one down here on the right, high blood glucose results are a sign that I've done something wrong or done something bad. Whilst this basis might have some basis, while this belief might have some basis, however, this doesn't mean that you're wrong or bad. And like a few of you have mentioned, often you're eating the exact same thing, you've got the exact same routine, you're doing things the exact same way, but then for some reason your blood glucose levels are different and you can't understand why. So often this belief is not only unreasonable, but it's really inaccurate, and some people will start to criticize themselves for the lack of control. Whereas actually there might be other reasons for it. And what we often do in psychological therapy is keep a record over the week of kind of what you're doing, what you're eating. I mean, I'm sure a lot of you do this already, but also we'll want to be monitoring your mood and see how your mood might also impact your blood glucose levels, and how your mood can impact actually how you're feeling in terms of feeling very tired. And then we'd look at how can we try and make some changes. So rather than just looking at the physical aspect, we'd also want to be taking into account your mood. So more helpful thoughts, more balanced thoughts that we might work on in therapy is, where I must have perfect control of my diabetes. A more balanced thought, if we challenged it, would be around, I'm doing my best to manage my diabetes. An old thought would be, any blood glucose result that's too high or low means I've done something wrong or bad. But actually a new thought, when we challenge it and we look realistically and objectively at it, have you done anything wrong or bad? No. These unexpected results can happen for many reasons, which are often completely outside of my control. And we try and work with the client to help them not be personalizing that, and even kind of maybe do a responsibility pie chart to look at what are all the other factors that could be involved in this, aside from it being my fault and because I've done something wrong or something bad. If I ignore diabetes, it can't hurt me. So this is like that avoidant coping that I said that some individuals get into. But actually avoiding, as we're all aware, avoiding thinking about it makes things worse. And then someone might have an old thought, I hate the way that diabetes is controlling my life. And a new thought that we might work on in therapy and challenge would be, actually investing some time and energy into it will enable me to stay in control of my life and my health. So just a couple of, a bit of an overview of what we might do in sessions to help look at the evidence for and against some of these beliefs and these thoughts, and actually start to challenge them. And we generally ask clients to keep a bit of a record in the week. What kind of thoughts come up for you? How do you view yourself in these situations? How does that make you think about your diabetes? Let's bring that into the session and let's look at those thoughts and how realistic they are. Okay, boom bust cycle. Has anyone heard of the boom bust cycle? So this is something that when we work on chronic health conditions in psychological therapy is really, really core. So this is relevant to a number of different chronic health conditions. So diabetes, but also cardiac issues, fibromyalgia, chronic fatigue syndrome, Yeah, those are the main areas that we, chronic pain as well. So this is characterized by that tendency to push ourselves when feeling good, leading to overexertion and then a subsequent crash. So we can see that it's going kind of this up and down. So too high, too low, too high, too low. It's that boom, bust, and we want it to be more kind of stable. So in terms of the relevance to diabetes, individuals with diabetes can experience this kind of boom and bust cycle due to the fluctuations in blood sugar levels. So fatigue and other symptoms related to the condition can have these real fluctuations. So for example, let's say there's a period of good blood sugar control, that might be the boom. This might then lead to increased physical activity, followed by a period of higher blood sugar or fatigue, which is that bust. And then another example is someone with diabetes might do a lot of exercise when their blood sugar, whoops, I think I just went off the slide. Can you still see the same slide?
Yeah.
Yeah, okay. Yeah, another example might be someone with a person with diabetes might do a lot of exercise when blood sugar is stable, but then experience a crash due to high blood sugar or fatigue after. The same as kind of chronic fatigue. A client with chronic fatigue might try to kind of make up for lost time on a good day. So they push themselves more because they're kind of feeling better, but then that leads to increased fatigue and a need for extended rest. So a lot of what we would do is keep records over the week in terms of, are you falling into this boom bust cycle? Because we want things to be more kind of regular and more stable. And if we think whenever there's a bust, if I've overexerted myself or I'm feeling so tired I can't do anything, can't do what I need to do, then that comes into, then that brings in beating myself up, maybe feeling frustrated, feeling fed up. So that's why we want to kind of get on top of that. So in terms of Sutton Talking Therapies, it's tailored treatment for people with chronic health conditions and support that addresses both emotional and practical challenges. Sorry, that's meant to say focus on type 1 and type 2 diabetes. How do these types of therapies work? Well, it can help with adjusting to a new diagnosis. It can help with managing negative thoughts, coping with anxiety, enhancing resilience and confidence in managing a condition. Also, we run some groups. So in terms of that, it's helpful to be able to share with others. And I guess this is what's fantastic with this group that you have, is that it enables you to do that. But within the therapy groups, we're actually delivering the therapy and also kind of sharing together. So what do we offer? There's a lot of psychoeducation, so understanding that mind and body. Okay, so in terms of my mind, my stress levels, my mood, how might that impact my body? How might that impact how I follow my healthcare information? And then vice versa, then how does that have an impact back on my mental health? We do some mindfulness-based approaches. Mindfulness is focused on that kind of acceptance, then rather than trying to avoid and push away some of my difficult thoughts, allowing them to be there and accepting them. Often the more we try and suppress our thoughts about our health or worries about the future, the more we try and suppress and block, the more they come back. So we want to be processing this, that we find with clients that can really help those thoughts. We run workshops focused on diabetes-related emotional challenges. We offer cognitive behavioural therapy. This all focuses on changing unhelpful or making more helpful behaviours and more helpful ways of thinking and more helpful beliefs about my condition, my future, the impact on my life. Obviously, managing a chronic health condition, there's always going to be difficulties, and that's the realism of it. And times can be more difficult than people who aren't managing a chronic health condition. However, aside from that, often people can experience kind of very extreme negative thinking or kind of a lot of worry. And it doesn't need to be that way. Certain parts might be tough sometimes when symptoms are out of control, But then that worrying about it, that kind of feeling low about it, frustrated, fed up, that doesn't have to be there. And that's the side that we'd be focusing on. We also ask for information in terms of healthcare guidance, in terms of general health information that you follow, to help our clients actually follow that as well and monitor what they're doing, and to understand maybe any patterns in terms of fluctuations. The aims of the therapy for long-term health conditions, which is a big push now in the NHS, having this integrated treatment, mental and physical health, not just focusing on a physical approach to chronic health. Helping patients accept and adjust to the impact so they can make the most of life despite the condition. Improving self-management of a health condition. Okay, so what we generally see is clients that come for psychological support. So it's holistic. We're improving their mental health, but also that has a beneficial effect on their physical health. So it keeps feeding into one another. And we're moving away from this mind-body dualist view. We need to start seeing these two together, helping see how mind and body are connected, so they can engage in psychological approaches to improving their health and vice versa. Common, just an overview as well, other common long-term health conditions that we would see and we treat. We've got diabetes, that is predominantly type 2, but we do support people with type 1 diabetes. Respiratory conditions, long COVID, chronic pain, cardiovascular conditions, IBS, or kind of medically unexplained symptoms like chronic fatigue, cancer, neurological conditions. So these are kind of the main areas that we might focus on. In terms of the inclusion criteria for being able to access psychological therapy for a long-term health condition, is having a diagnosis of it, obviously, and having any type of low mood or anxiety. Okay, this doesn't mean that a client would have a depression diagnosis or an anxiety diagnosis. Most clients that I see, they don't have a diagnosis of depression or anxiety. They're just going through a challenging time where they're struggling to manage their mood around their health, or actually symptoms have become more out of control and they're not quite sure why, and it's causing a lot of worry. Okay. And what we generally do is we have an initial assessment, which is 30 minutes, and we just use some questionnaires to identify any symptoms of worry, frustration, fed up, impact on sleep, impact on motivation. Is it causing kind of increased tiredness? Is it causing actually kind of physical anxiety symptoms in the body? And then we'd use that to create a treatment plan. In terms of exclusion criteria, so for NHS primary care services, the exclusion would be for complex psychological and physical health needs. So this is, let's say, someone who needs more complex psychological might be things like EUPD, bipolar disorder, that's not really treated in primary care. And if it's very, very complex physical health needs that would really need just a specialist team, then we may not treat clients. But actually, most of our clients are have gone through other types of therapy. Also, for example, with pain, the Centre of Pain Education provide support around managing pain, but we'd also see them within our service. So focusing on kind of a physical health service and a mental health service. Clients in end-of-life treatment, clients with many repeated episodes in talking therapy. So for example, clients who've maybe come through the service kind of 10, 11 times. Clients who are open with other mental health services. So if you were receiving treatment from another mental health service or secondary care or private psychologist, it's not good to mix two therapies at the same time. So you'd want to do it kind of one at a time. Severe or enduring mental illness, like I said, so kind of things like psychosis we wouldn't see. I just got this over off our list of general exclusions, so some of them are not so relevant to here. Clients with kind of, misuse of substances. So I'm going to move on because I'm aware of time and I wanted a little bit of time to kind of talk afterwards. So who would benefit from this? So just for you to be aware, if, now or in future you thought this could be helpful for me. Diagnosed LTC, so diabetes, or even any other chronic health condition, any worry, anxiety, or low mood about health, any concern about long-term consequences, negative thoughts, isolated, withdrawn, not adhering to medical treatment. You don't need to fall into all of these, but these are just kind of suggestions to help people realize, oh, maybe this could be beneficial for me. The benefits of taking that holistic approach to managing diabetes is improved mental well-being, better self-management of diabetes, like I said, from all of the work that we do and looking at patient outcomes, focusing on the holistic approach, the mental and physical has the best outcomes. Increased, as that say, adherence to treatment, greater quality of life. And this is just in terms of referrals. So we deliver, we're an NHS talking therapy service. We're based in Sutton, but every borough in London has one. So it's self-referral, GP referral, professional referral from a healthcare provider, if you've got a nurse that you see often, from the nurse. It's a free NHS service. And this is our website. It has lots of information and it has more info on like the diabetes workshops that we deliver. For our diabetes workshops, you don't need to be in the service. You can sign up online through Eventbrite. So you don't need to be registered to the service to access those. Okay. So that's everything I was hoping to kind of go through to give a bit of an overview of managing the psychological side of the condition. I just wanted to take any kind of questions